Record. Okay, Dr. Lloyd Sederer, MD. I'm just going to introduce you a little bit. You're a distinguished psychiatrist and public health expert, and a prolific nonfiction author, about to release has it released yet, the 14th book?
Yes, yesterday.
Oh, okay. Oh, great. So it's already a bestseller from what I hear.
Yes.
Um, you are currently an adjunct professor at Columbia University, the School of Public Health. You've served as chief medical officer and executive vice president of McLean Hospital, which is a Harvard teaching hospital. You've served as mental health commissioner in New York City in the Bloomberg administration, chief medical officer of the New York State Office of Mental Health, which is the nation's largest state mental health agency. And in those positions, you've done an incredible amount of good. I mean, that just summarizes a huge career of decades where you've probably saved countless lives. I know there's a great story you told me about how you instituted a policy that mental health clinics in New York had to offer Suboxone treatment, which is life-saving.
Yes.
And yeah, that's incredible. And you've won a ton of awards. I mean, I don't want to take up all our time listing them, but
No.
people should go to your website and read your profile, and definitely read your blog posts and follow you on social media. But let's talk about the book, Caught in the Crosshairs of American Healthcare. It's a great book, and you talk about your experiences at McLean and issues in American healthcare, which I think we all know. I think anybody listening who's an American knows that healthcare is a mess. So you tell us a little bit about the book and everything.
First, thank you for having me on, Mark, and I always love speaking with you online or otherwise, and thank you again. I tell stories. This is not a technical book. It has a lot of particular details here and there, but I think that the way to understand things is through stories. It's an ancient way of communicating. So it's the story told in different ways about how for-profit corporations have taken control over medical care in the United States to the great detriment of you, me, other people who are dependent on medical care. And I use as an illustration McLean Hospital, where I was chief medical officer, as an example, because it's a first person example. I was there. I was there during when the impact hit, when managed care hit, when suddenly the referrals to the hospital tanked, when we started to hemorrhage money. And it took 5 or 6 years, and we righted the ship, and it has prospered since then for the past 30 years. But I had that firsthand experience. It wasn't abstract, and I tell that story as well. And I tell it in some ways also by providing clinical cases or talk about some of the patients I've worked with.
Yeah, yeah, and healthcare. I don't think there's any easy, great solutions. You look around the world, and there's other countries that have healthcare included as part of their government, and there's a meme on social media that with all this military action unfortunately going on in the world, where they show some fancy American bomber flying by, and they say, "Oh, the world's going to find out why we don't have free healthcare," which is not, which which could be, you might say, is good or bad. I mean, at least we might feel safe, or the world feels safe in some degree, maybe, maybe not. But there goes our healthcare flying by as a multi-billion-dollar
It
bomber.
seems to me there needs to be another meme that represents not just spending money on bombers, but siphoning money off to corporations, to insurance companies, to managed care companies. And this is so fundamental that there are regulations. It's called medical loss ratio, the percentage of dollars, patient care dollars, that can be siphoned off by an insurer. And it often is up to 15%. So we start out in American healthcare in all these ways, including now entitlement programs, Medicare, Medicaid, where the payer or the payer's manager, administrative manager, like a managed care company, takes 15% off the top.
Oh, what, 15%? Well, that's so what we pay for healthcare. I mean, and of course, like we pay a huge amount for healthcare. It's unaffordable to most people. I mean, just the thought of medical bills coming in, it's like, what did I just pay for? You get like this $1,000 bill for a bill for $1,000 for going to the ER, and it's like, wow, why am I paying $1,000? And then it's like, no, you didn't pay for your whole visit wasn't 1,000. That was just for you to sit in a room. And now there's a
Yes,
bill from every doctor and radiology, and each different entity sends a bill, and and there's no way that all of that. One interesting thing in South Florida, I think, or maybe in the state of Florida, which I think is different from other states, is that there was a period of time where people had to get MRIs for pain management, and this was kind of tied in with the pill mill issue. That for these pill mills to try to be legal, they would require people to get spinal MRIs, low back MRI, and so the MRI businesses jumped in and said, well, we can do MRIs for $200 or $300. A study that normally costs $3,000 to $5,000, the same exact study. And in fact, if you went into the same MRI center with insurance, it would be billed for thousands of dollars. And they somehow figured out a way that on the side they can charge a cash paying patient 200 or 300 for the exact same study. So we're definitely overpaying. These things are being charged a lot more than the value or what they're worth.
yeah. It's like going into a marketplace with shops everywhere, and there may be a retail price in the window, but inside, if you talk to the owner, in this case an insurer, you can bargain down the price so you can get it for cheaper.
Yeah, and I think that hospitals, from what I've heard, and this is a good tip probably for people that get a big bill from the hospital. I think you can negotiate, like we have a right to negotiate to get Medicare, what Medicare would pay. So if they charge you $1,000 and you find out Medicare would have only paid $200 for that same visit, you should be able to negotiate with the hospital and do it quickly, because if you wait too long, you lose apparently the window of time to be able to do that.
Yes, that's true. Medicare, and that's traditional Medicare. That's not what's called Medicare Advantage, which are the managed care companies that now provide insurance to 50% of Medicare beneficiaries. That's like 30 million people. And they are for profit companies, and they are defrauding, many of them in serious ways, defrauding the federal government by what's called upcoding, putting a code for a higher rate or a higher risk adjustment so that they get paid more, by adding procedures like you were discussing, a spinal tap, and they make a lot of money, and they pretend, or they offer the client, the subscriber, it's going to cost less. You're going to have better access. It's going to be better quality, and none of that is true. None of that. So they're fraudulent in their advertising, and they're fraudulent in their billing. So fraudulent that the federal government, through health services, has brought a lot of them, quite a few of them, to the Department of Justice, and the Department of Justice has taken them to court and won. But the sad part of that story is they get a fine, $10 million, whatever. And that's such a fraction of their revenue that they just pay the fine and keep doing the same thing. That's how greedy and that's how fraudulent some of these companies are, particularly the Medicare Advantage companies.
Yeah. And another point that you've made is that things have gotten to the point where doctors don't want to even be in this business anymore. And I know, and my father, who probably would have been, he'd be a little bit older than you at this point, but uh, he had told me that like in the 70s when he started his practice, that I think I heard it from other people also, that was the golden age of medicine, that doctors were happy, they had good careers, they could have their own little practice, and things changed dramatically. Like when I went to medical school, HMOs were like well entrenched. In fact, that was part of our education of learning managed care. And it was and in fact, I remember hearing other doctors in training say, you guys all missed the golden age of medicine, like when we were all happy and doing well. And I've also heard stories from, I've heard people say that the business people in the business of medicine saying that the best way to be successful is to have patients be a captive audience, where they're, and I think that ties in with what you're saying about Medicare Advantage, is that once you're in one of these plans, you're stuck, you only have like short windows, I guess, to jump from one to another. And maybe there's nothing really good to jump to. You're jumping from one bad situation to another.
This is a huge problem, a workforce problem. Doctors fleeing medicine. It began with COVID, but it has been sustained so that it's now affecting our ability to get care because hospitals are not adequately staffed, not with doctors, with nurses, with technicians. Very hard to get an appointment. And when you get an appointment, particularly primary care, you get a 10-minute appointment
Yeah.
where the doctor's mostly typing into the electronic medical record. So the whole nature, delivery of medical care has changed in a destructive way since when your dad practiced.
Yeah. Yeah. And there's definitely things that we need in medicine. Like if someone has something life-threatening and like they need a surgery for a trauma, or they need a major surgery, and they're going to come out of it fine, and without the medication or the surgery or the procedure, they would die, but they can live a long life if they get that. Those things are essential, and some of them are very expensive. But then a lot of medical care, kind of, to me, it never made sense that insurance would cover every last thing in your healthcare. Like when I get car insurance, I don't expect it to pay for an oil change or tires. Routine wear and tear and routine service should probably be something that people pay for. But because, like you said, because big business is involved and insurance is involved, prices get driven up where, it shouldn't cost what it costs to get basic service, to go to a doctor's visit or get like we were saying, the MRIs are 10, 20 times more expensive than what they should be. And you hear about people going to Mexico and other countries, and in
Mhm.
some areas actually getting decent medical care for a fraction of what they get it for here, for various reasons, whether it's prices driven up by insurance, or I mean, some people say it's because of fear of litigation, but I think it's more the insurance and the fact that you can't charge one price and also deal with insurance, and so they drive prices up.
Yes, and the primary purpose of a for-profit corporation, the primary purpose is to make a profit.
Yeah.
It used to be that medical services, the primary purpose was to serve the patient, to serve the family, to serve you and me. That has been wiped out, and it extends now. There was a piece recently in the Times because it has been shown over and over again that that's the case with for-profit corporations, huge insurers like United, Aetna, um, Anthem, that they've been squeezing the dollar out for a long time, and in some ways in these managed care plans fraudulently. But now, not for profit hospitals, which are about half of the hospitals in the country are not for profit, the ones we tend to know the most are university hospitals, uh, University of Florida, whatever. And they're also behaving like profiteers. And that's because executive compensation, the CEO of that university hospital, that for not for profit, his or her compensation is determined 75% of their compensation is determined by what kind of revenue, what kind of profit they bring in. So
Well,
it's they're not running an organization that's meant to take care of people. They're running an organization that's meant to deliver for a profitable commodity.
even a nonprofit hospital is playing that same game of profit, of
Many,
acquisition.
many, many are, and that's become just how ubiquitous the greed and the destruction of quality ethical medical care has become. And that's why I wrote this book. Not that I'm the only one, but I wanted to pitch in my voice because I've lived it. I saw what was needed to save a hospital from going under, from being sold, when threatened by managed care, when threatened by insurers. We did it, but it was a hard time, but we succeeded, and other people can succeed. And people have asked me now, I've thought about this even more. Are there any solutions to this, corporate raping, if you will, of medical care? And I see three. And these are three that are in our control. It's not waiting for a miracle from the federal government or the miracle of universal health. First is patients and families. The second is professions. And the third is judicial, not federal government, but the courts. First, patients and families. And what I have urged people and discovered works is you have to be a demanding patient or family. You can't just be meek or afraid of the doctor, because you'll just get bypassed. And my experience is that the best patients are what we used to call difficult patients. Now they're demanding, which is they're demanding what's due them. They're demanding to know what's the matter with them, why the doctor has posed this plan, what the alternatives are, what the costs are. Those are demanding patients that begin to tip the balance about what's going on. So that's really critical in terms of one solution. The second solution is professions. And I'll just concentrate on the doctors for a moment, because the doctors have two tools to win against corporatization that they're starting to use, but not very much. The first is to unionize, because then they can strike. And striking is a very powerful way of fighting back against bad control, because if doctors go on strike, a hospital doesn't make money. Beds are unfilled. So we're basically then attacking what's most important to these companies, which is revenue, which is profit. The second is, and there are some examples of this, particularly in California, there are large doctor groups that have very big contracts with insurers, particularly Medicare Advantage. And one practice in California did not renew its contract with this private Medicare company, and it shocked everybody. And 30,000 subscribers, 30,000 patients and their families suddenly had no place to go, had no doctor, had no care system to go to. That is disruptive in a way that will change things, painfully, but will change. So the two things are unionizing, going on strike, and basically not doing business with these companies. And when asked, these large practices, why they do that, they say two things. Well, it's just too much of a burden to deal with them, the administrative hassle, and they pay poorly. Why should I renew this contract? And the third reason is, or third method of fighting back, is judicial. And what I mean by that is that courts, administrative courts, can appoint a special master to a company, to a state or federal agency. Basically, they are suddenly put in charge. Everything has to run through them. And that's how culture can be changed, because this is a culture of greed. And a special master is there to see that the company does right, that it serves the people it's supposed to serve. And so the third is a court-appointed special master over some of these companies, particularly the ones, I imagine, who are repeatedly fraudulent, because the fines are not doing anything to change them. Those are three methods of fighting that are within our grasp, and and don't need to wait for a miracle.
Yeah. And would that help as far as because, I see like probably the real problem is corrupt politicians. They've done a lot to make sure that doctors are not corrupt. We can't even, a drug company can't even give us a free pen anymore. And, when I first started, they could buy us tickets to a baseball or a football game and put us in a fancy box and get served dinner. And, that was probably kind of extreme, but, we can't even accept a pen with a name of a drug company because we're being influenced. But every one of these companies, I'm sure, has a lot of lobbyists that are doing all kinds of favors for politicians, and they don't. I feel like if politicians had the same rules that doctors had, that they can't get paid off and they can't have special favors and take a lot of money from people. I mean, all the stuff that happens. I mean, it just seems like these companies can get away with anything. But maybe by following those three steps that you outlined just now, that at least, I don't think we're going to change politics and get rid of lobbyists and get rid of, change that whole thing. But there are some things that we can do now to make a difference.
Yes, yes. The federal government, anyway, which might stand a chance to correct things, is paralyzed at this point.
Yeah.
And the divisiveness is appalling, and it prevents any action. So, particularly a difficult action like holding payers or insurance companies or private equity companies to task, it's never going to happen because of how funded they are, and this pharmaceuticals as well, and because the federal government, the Congress, has decided we're not going to do anything to help one another, which is not what government is supposed to be about. It's supposed to be about coming together to help.
Yeah. Well, that thing about private equity, that I think is a major thing that's become a much bigger issue lately. I've noticed almost every private hospital in South Florida has been bought by one company. And when I look them up, they're one of the largest private equity companies. And now people are saying only go to public, like the hospitals that we used to be told to stay away from, the public hospitals, the county hospitals. Now people are saying those are the only places you should go because these companies are going to kill people by trying to profit. The things that make them money are things that could be very dangerous to patients.
Yes. And the and sometimes you know the private you know of because they're massive private equity companies, but sometimes it's silent or it's hidden because their hospital needs money to operate the building services. A private equity company shows up and says, "Well, we'll give you $4 million a year for the next 4 years, so you can do this and that." But you have to pay us on our investment, not 4% like a bond, but 15%. So, also another way by which money is siphoned off, and basically the hospitals and other doctor groups are required to indirectly fund these private equity companies, which do very well for their investors because they're automatically siphoning off money from patient care.
Yeah. And I think I think people also need to, like you said, they need to be more informed. If necessary, when you go to the doctor, bring someone to represent you, to be, a family member that's knowledgeable. And now with some of these new AI tools, like we can all be a genius, and we can take contracts and feed them into the AI and say, read the fine print for me. And, I mean, and there's things, things that are like magical, like insurance companies. You can sometimes, if you write a letter at the right time and fax it to the right number, you can actually get results. And you almost never get results when you call them on the phone and yell at them. That seems like a tactic to delay things. And there's like little tricks like demand a third party arbitration or something like that. Things like that. And magically things happen when you say the right words, as per the fine print and the contracts.
Yes, that is being a demanding patient or a demanding subscriber, which is not taking it lying down. It is not letting yourself be exploited.
Yeah, yeah, definitely. So, Dr. Lloyd Sederer, thank you for joining me. And I recommend everyone go to Amazon, go to your nearest bookstore, buy this book, Caught in the Crosshairs of American Healthcare. It's a very good book, very enjoyable read, and a lot of insight into your experience at McLean, and also a lot of interesting analysis of the healthcare system and solutions, ideas for what we can do today to make a difference. So thank you.
Thank you, Mark. Always a pleasure to be with you.
Thank you.